Hello everyone, welcome back to Medical Digest, and in today's video we are going to talk about the subtopic anatomical terms. This is the video third of the video series on the chapter anatomical terminologies. In this video we will be concentrating on the subtopic called anatomical terms. So what are basically anatomical terms? These are the terms which are used to describe the relationship between body parts and the structures relative to each other. For example, I want to discuss the relationship between the shoulder and the wrist. So what should I do? How should I compare that where is shoulder placed exactly in our body and where is wrist placed exactly in our body? So I can just say that shoulder is proximal to wrist or wrist is distal to shoulder. So you will understand what is exactly these kind of terminologies. Just make yourself understand that this anatomical terms form the core of the anatomical language. It is really important. Now coming towards one set of anatomical terms which are quite confusing. First we will go one by one. First is anterior, posterior. Okay, so what is anterior? Towards the front aspect of the body. As you can see here, this is the front aspect of the body. So the anterior is towards the front aspect of the body. When it comes to posterior, it is towards the back aspect of the body. So this is the back aspect of the body. So anything towards the back aspect of the body is termed as posterior. Now anterior can be interchangeably used as ventral, or they may seem same because ventral is towards the belly. So belly is nothing but some part of the anterior part, right? So we can also term anterior as ventral in some cases, and we can term dorsal as posterior in some cases because it is anything which is going towards the back of the body. But when it comes to exact precise difference between anterior and ventral, anterior is towards the whole front aspect, whereas ventral is towards the belly. When it comes to posterior and dorsal, it is towards the whole back aspect of the body, and dorsal is towards the back. Hope this is pretty much clear. Now coming towards superior and inferior. Superior is nothing but anything towards the head, and inferior is nothing but anything towards the feet. So when we go upward, it is superior. When we go downward towards the feet, it is inferior. So superior can be interchangeably sometimes used as cranial or rostral. Why? Because it is also going towards head. So anything going towards head is superior or cranial. And the difference between inferior and caudal is that inferior, we say that it is going towards the feet, and in caudal it is going towards the tail. But when we say that in four-legged animals like dog or a cat, this is the tail, okay, and this is the tail, and this is the last feet. So in these people, this is the posterior part and this is the caudal part. But since in humans the tail and the feet are in one axis, so the direction of both the terminologies comes in the same plane. So so inferior and caudal can be interchangeably used in some cases in human beings. Here is the tailbone, and anything going towards the tail is called as caudal, and anything going towards the feet is called as inferior. Hope this is pretty much clear. Now coming towards another set of terms which are quite similar and they are quite related to each other and hence can become confusing. Moving first towards the central. Central is what? Towards the center of the mass of the body. And when it comes to peripheral, it is away from the center of the mass of the body. For example, when we say that towards the center of the body is the central nervous system, and central nervous system consists of brain and spinal cord. And when it comes to periphery, it is towards the surface of the body, right? That is peripheral nervous system. That is the nerves. We say that brain and the spinal cord are in the center, and from the spinal cord arises the different kinds of nerves which are going towards the periphery. So hence they are going away from the center of the mass, hence the term peripheral. Now when it comes to superficial and deep, these two terms, we need to understand this because it is quite important that these two terms are used to describe the relative positions of the two structures with respect to each other according to the surface of the body. Like for example, superficial is towards the surface and deep is towards the center. Example, skin is a superficial structure and our internal organs are deep structure. Simple, because skin is placed on the surface of the body and internal structures are placed more towards the center of the body. Now when it comes to external, it can be interchangeably used and can get confusing because it is also a term which is referred for anything which is close to the surface of the body, and superficial also says that anything which is towards the surface of the body. And what is deep? Deep is towards the center, and internal is also close to the center of the body, but the difference is it is towards. Okay, this is towards, and external is close to the surface of the body and internal is close to the center of the body, whereas deep is towards the center of the body. These are minor differences, but sometimes these two terminologies can be used interchangeably or may be confused. So these are certain things which we need to understand, but more or less what exactly does this terminology mean is the most important thing which we need to understand in this video, right? Now when it comes to interior and exterior, these are the two terms which are related to hollow organs. All right, what are hollow organs? Hollow organs is nothing but our gastrointestinal system, because they are nothing like tube like whole structures passing through our body. So anything inside hollow organs is interior and anything outside hollow organ is exterior. This cup is a hollow structure right now given here as a prototype. Anything which is inside it is interior and anything which is outside it is exterior. Hope this is pretty much clear, and I have tried that the connecting terms or the closed terms come in the same set of explanation of the terminology so that you understand the subtle differences between these terms. And let's move ahead with our another set of terminologies. Now these are another set of terminologies, quite related, can be confusing. Let's move ahead. When it comes to median, okay, median, wait a minute. Right, so when it comes to median plane, this is nothing but which passes along mid-sagittal plane. In my previous videos, I have pretty much very clearly explained what is mid-sagittal plane, what is sagittal plane, what is coronal plane, and what is transverse plane. Do check out my previous videos if you want to get an insight of what these kinds of planes are. But to be very precise right now, mid-sagittal plane is a median plane which passes exactly through the midline of the body. It passes exactly through the sagittal suture, and it divides the bodies into two equal halves on the right and left side. And when it comes to medial, anything which is towards the median plane, like this point here is near to the median plane, it is going towards the median plane, hence this point is termed as medial. When it comes to lateral, away from the median plane. Now this point here is going away from the median plane, hence it is termed as lateral. So whatever anything is going towards the median plane is termed as medial, and anything which is going away from the median plane is termed as lateral, and anything which is in between medial and lateral is termed as intermediate. So intermediate is nothing but between medial and lateral. So this point here is termed as intermediate. Now coming towards another set, that is invagination and evagination. Pretty much simple, pretty much clear, nothing fancy in this. If this is an organ and it has got an inward protrusion, it is called as invagination. And when it comes to evagination, any organ which has got an outward protrusion is called as evagination. Now when it comes to ipsilateral and contralateral, we need to understand that if I consider this part of the body as reference unit and I place my organ, or I point out this part of the body, then we say that it is on the same side of my reference unit. Okay, it is on the same side of the body, so hence it is ipsilateral. But if I consider this as my reference unit and I point any organ in this area, so it is something which is opposite to the side of the body, hence the termed as contralateral. Contralateral is nothing but opposite side of the body. And when it comes to explaining this structure, it shows relationship between the location of three different parts in the thorax, in the thorax and the median plane, that is medial, lateral and intermediate. I have already explained these 3 points, that is medial, lateral and intermediate. Medial going towards the median plane, lateral going away from the median plane, and intermediate anything that is between medial and lateral. Also, it shows relationship between elbow and wrist. What we say is that elbow is a distal structure. You will understand it in the upcoming slides, but just remember that when we say that wrist is a distal structure and elbow is a proximal structure, we are comparing it with something. Okay, we are taking a reference point and then we are comparing. We cannot say that okay, this point is proximal to this point. This is something which we need to understand, and we will understand in the upcoming slides. When we say that wrist is distal, it is distal to the elbow. So what we can say is wrist is distal to the elbow, or elbow is proximal to the wrist. But when we come to elbow and shoulder, we have to say that elbow is a distal structure and shoulder is a proximal structure. So these are relative terms, and anything which is going towards the trunk, this portion above this line is the truncal portion. So anything going towards the truncal portion is the proximal part, anything going away from the truncal portion is called as distal part. We will see this further. Alright, now coming towards the special terms of the limbs. As we have discussed earlier, what is proximal, what is distal. Anything near towards the trunk, anything near the trunk is proximal, away from the trunk is the distal. So this is the proximal towards the trunk, and this is distal away from the trunk. Now when it comes to radial, ulnar, tibial and fibular, we need to understand certain structures so that we understand these things properly. First we will read what is radial. Radial is nothing but towards the outer border of the upper limb, and ulnar is towards the inner border of the upper limb. So we will first see what is radial and what is ulnar. So we see that radius is towards the outer aspect of the upper limb, and ulnar is towards the inner aspect of the upper limb. So it is nothing but the same. Anything which is near the radius bone or going in this direction is termed as radial, and anything which is going towards this direction is termed as ulnar. Hence the term towards the inner border is the ulnar and towards the outer border is the radius. Now coming towards tibia and fibula, we need to understand that this structure here, this part, it is the tibia. Now when it comes to tibia, it is placed anteriorly, alright, and slightly towards the outer. You might think that this is the inner border and this might be the outer border, but this is not the case. Tibia is placed slightly anteriorly, and when we observe our leg, what we observe is the prominent part is towards the anterior and towards the outer aspect of the body, and fibula is nothing but slightly laterally and posteriorly placed. So what we understand by this terminology is tibial is nothing but towards the outer border of the lower limb, and fibular is towards the inner border of the lower limb. Until now, make it pretty much clear that radial is towards the outer border of upper limb, tibial is towards the outer border of lower limb. When it comes to ulnar, it is towards the inner border of upper limb, and fibular is towards the inner border of lower limb. Hope this is pretty much clear. Now moving further. Now these are the two diagrams which shows the relationship between neck and shoulder. So when we say that this is the neck and this is the shoulder, when we see neck towards the shoulder, what we are when we trace the neck from the shoulder, what we do, we are going in this direction. So what we are basically doing, we are going superiorly as well as medially. So the neck is placed superior-medially as compared to the shoulder. When we go from neck towards the shoulder, what we are doing, we are going inferiorly as well as laterally. So what we say is shoulder is placed inferolaterally as compared to the neck, or in relation to the neck. Same here, this is the buttock area and this is the knee area. When we go from buttock towards the knee, we go inferiorly and anteriorly. So we say that knee is antero-inferior. But when we go from knee towards the buttock, what we do, we go it superiorly and posteriorly. So we say that buttock is placed posterior superior in relation to the knee. Now coming towards the preaxial and postaxial borders, this topic is quite confusing, and it will actually, to be really honest, will need a different set of video, a different whole video which is completely dedicated to the preaxial and postaxial border. But for this video purposes, just remember that this is something which is related to the rotation of the limbs. Okay, this is something which is embryologically related. For right now learning purposes, you need to understand that outer border of the upper limb is the preaxial border as shown in this diagram, and inner border of the upper limb is the postaxial border. This is actually the main axis of the upper limb. Hence the outer border of hence the border which is outer to the main axis is the preaxial border, and the inner border of the upper limb is the postaxial border. When it comes to the lower limb, it is exactly opposite, and that is the reason why I am telling that it is related to the rotation of the limb, because the limbs rotate, upper limbs rotate outward and inner limbs rotate inward. So when it comes to the preaxial border, outer border for upper limb corresponds to the inner border of the lower limb. Hence the preaxial border is near to the inner border. This is the preaxial border, and it, as you can see, it is getting traced towards the inner border of the lower limb. And this is the postaxial border, and it is getting traced towards the outer border of the lower limb. So when it comes to lower limb, inner border is the preaxial border and outer border is the postaxial border. Now coming towards the flexor surface, extensor surface, we need to understand that from this point, from the shoulder point, when we do extension, like if this is the neutral portion, we do flexion in this direction and extension in this direction. So this has created a general terminology that this is the flexor aspect of the upper limb and this is the extensor aspect of the upper limb. This is in relation to the shoulder as well as the elbow, because when we flex our elbow, we flex in this direction, and when we extend our elbow, we do extension in this direction. So basically nothing but going towards front is the flexion, and going backward is the extension. So anterior surface of the upper limb is the flexor surface and posterior surface of the upper limb is the extensor surface. Here I have mentioned that this is the flexor surface of the upper limb and this is the extensor surface of the upper limb. When it comes to the lower limb, we can say that again flexion might be in this direction and this direction when it comes to the buttock region, but this is more related towards the knee. We have taken knee as a reference point. So when we do flexion, we go backward, and when we do extension, we go forward, right? So this has created the terminology for the flexor surface, that is the posterior surface of the lower limb is the flexor surface, the posterior surface of the lower limb is the flexor surface, and the anterior surface of the lower limb is the extensor surface. When it comes to the palmar or volar surface, we need to understand that this is the palmar portion, and anything going towards the palm is the palmar surface or the volar surface, and this is the sole of the foot. So anything which is going towards the sole of the foot or towards the sole of the feet is termed as plantar surface. We also term sole of the feet as plantar. So going towards the sole of the feet is the plantar surface. Hope this is pretty much clear. This completely wraps up the entire topic. This topic was quite lengthier. Hope you have stayed until this point, and I have tried my best to concise all the confusing points together, and hope you have enjoyed this video. Do share it with maximum of your friends, and please do subscribe to my channel because it helps me keep motivated. Until then, stay tuned with my YouTube channel. See you in my next video. Take care. Bye bye.